We're gonna put this in some of the. Okay, we're gonna start. We're gonna talk about dementia and difficult behaviors. Okay, and so and how do we deal with patients who have difficult behaviors, all relating to dementia. That's okay. We're starting our in-service. That's okay. That's okay. So come on in, gather together, guys. Today, we haven't started here. Let's start right now. It's Tuesday, October 1st. We're doing our in-service on dementia specifically. And again, we talk about dementia all the time, but the most common dementia that we deal with in terms of patients is Alzheimer's. Okay, you guys are going to run away from me, huh? You're not going to run away from me because I'm going to put the video over this way. So, patients with Alzheimer's, okay? And these patients can exhibit a lot of behaviors, right? You can have confusion, you can have delirium, you can have sundowning, you can have wandering, right? We're gonna talk about this. You can have anxiety, agitation, right? We're gonna talk all about these behaviors and how to deal with and cope with these residents that are going through these behavioral issues, right? Let's talk about stages real quick. Alzheimer's has 3 stages. There's mild, moderate, and severe, right? And at the beginning stages, which is the first stage, you might have, forgetfulness, and then the second stage is you're gonna have some issues in there, like forgetting family member's name, right? Obviously, the late stage is gonna start affecting your motor, right? You're gonna have difficulty walking, eating, swallowing. You're gonna have more infections in relation to those stages, right? And so this is important because this is part of your test too in terms of stages. But I'm not going to go over the specific thing on stages. Just know that there's mild, moderate, and severe stages, and you get worse over time. Also remember that when somebody has dementia or Alzheimer's, right, specifically, that your long-term memory stays intact. Okay, you might have short-term memory issue, but you're not going to forget like certain things that happened, occurred. They can go back 50 years ago to an event, right? They can have that in their memory bank. Okay, the short-term memory issue is going to be really important to kind of remember when you're taking care of these residents. Okay, challenging behaviors, and the reason why these residents have challenging behaviors in terms of Alzheimer's is because they have a problem processing information, right? Integrating, and then also retrieving new information. So if you have all these things that are happening in front of you, there could be an event going on, but you're not processing in your head incorrectly or correctly, you can have anxiety because of that, right? In fact, you might have some exhaustion, right? You're trying to figure this out. Okay, what's going on? And then because you're not able to verbalize your needs, you might have some agitation, right? You're gonna be pissed. You're like, okay, I'm trying to get my points across, but I'm not able to do this, right? And so you have aggression, right? Because you're pretty much like exhausted from trying to figure out these events that are going on. But because you have Alzheimer's, you can't process it correctly and you have agitation. Okay, that's the primary reason why people with Alzheimer's have agitation, is because their ability to process certain events, they can't process it correctly. Okay, you can come in, Zach. It's okay. You have a question? No, I just don't know what's going on. I just saw this table, like the council. Okay. So aggression and anger, guys, aggression can be caused by a variety of issues, including poor communication, physical discomfort also, and then environmental factors. For example, the person is unable to communicate. We talked about that. But also, these patients can have pain, right? And they're not going to be able to communicate that, right? And they could be scared, right? But also, you guys don't see what the nurses are doing, but they're giving away like a handful of medication. Seriously, like each one of these patients might have 10, 15, 20 medications in the morning, right? And these medications are not just like, your regular Tylenol, right? Some of these medications has significant side effects, that can make you dry, constipated, right? It goes against their other medication that lowers blood pressure, So there's a variety of things that are going on in their system, whether it's related to Alzheimer's or medication or pain. That's going to make them uncomfortable. And so, how do you approach these residents in terms of how to respond to them? First things first, you want to try to rule out their discomfort, having pain, right? What's the pain related to? If they're just having general pain because they have back pain, status post hip surgery, we're not medicating correctly, the nurse can take care of that, right? If they're constipated, right? Those are something that we can kind of really like visualize, right? As a CNA, you might see that their stomach is a little bit bigger. The patient might be going like this, and you note that maybe they haven't had bowel movement in a couple of days, right? That's something you can take care of and tell your nurse. Nurse can also take a look at when was the last time they have bowel movement, right? So these are things that we can assess and figure out and help our residents out. Try to identify immediate cause. Think about what happened right before the reaction, which may have triggered the behavior. Okay. Focus on feelings and not facts. Okay. So a lot of these patients are going to have some things in front of like an event, and then they may react to it right away. And so those are facts, but try to look at their feelings to see how they're reacting emotional wise, right? If they're reacting in a certain way, like aggression, but they're really having pain, and you can tell that they're grimacing, maybe they're responding to your questions, or they're coming to you, they're wanting to respond to you, but they're aggravated because they're having back pain or they're having constipation. So and that's pretty much the patients can exhibit those pain, but then they will be aggravated, and because that's their only way to respond to you. Okay. Don't get upset, obviously, and then limit distractions. Examine the person's surroundings and adapt to them to avoid similar situations. Okay. You can also, as an individual, if you're taking care of a patient that's very difficult, guys, don't forget to also take a break, right? Take a break when you have time. Take a break. Go outside. Take a breather, because it's not easy taking care of somebody who's difficult, right? And you might lose your head. You might lose your cool on the floor there, right? So it's important to not take things seriously. Just remember that these patients, again, that has Alzheimer's, and you're here to take care of them, right? They're here for a reason. And yeah, go ahead and take one of these tests right here. Okay, or have another activity. If the patient is just kind of sitting there, try to get them to activity, kind of, change their focus, right? Anxiety and agitation. Anxiety and agitation can be caused by a number of different medical conditions. Also, again, medications, right? That can cause that. The person with dementia is experiencing a profound loss of their ability to negotiate new information and stimulus. It is a direct result of the disease, right? Certain things that can agitate them or cause anxiety: changes in caregiver, or moving to a new home, or moving into a new room, right? That's why we put patients on charting when they move into a room, because you want to see if they're adapting to their surroundings, right? Because definitely patients who are not familiar with their surroundings, who has dementia, Alzheimer's, if you move them around, they're not familiar with a certain nurse or a room, they might have some anxiety, agitation, right? They can't help it, right? You might say, oh, come on, it's the same nurse, it's almost the same room, but they notice that, right? Travel, hospitalization, or the presence of a house guest, right? Fear and fatigue resulting from trying to make sense out of a confusing world, right? When we talked about that, they get really frustrated and tired of trying to figure out what's going on around them, and they can't, because it's very difficult, because the disease process, the Alzheimer's, is playing a factor. And then they talk about depression too, right? Depression in the elderly at this stage is different from the depression from the younger population, right? Because depression in this environment right here, a lot of patients are not going to be talking about depression, right? They're not going to be exhibiting it, but you're going to notice it. They're going to be withdrawn. They're not going to be eating, right? And so the way to respond to that is really to talk to your resident, get involved, right? Try to figure out what's different today. They're not eating as much. Let's figure this out. Let's take them to activities, right? So there's not a lot on depression here in terms of what we can do for the resident, but really just being active and being, getting these residents involved and communicating with them, because again, a lot of residents are not going to be sharing their feelings with you in terms of how they're feeling, right? Let's see, hallucinations, right? As is another one, right? Where a lot of these residents will start seeing things, right? Again, a lot of these factors can come directly from medication. Hallucinations can also be brought on by physical issues like infections. Medications keeps coming up as one of the main reasons here. Drug or alcohol abuse, dehydration is another one, right? We don't think of it, but like if a patient's not drinking as much and dehydrated, it's going to affect your mentation. Hearing or vision problems, and then a lot of these residents might have schizophrenia as well, right? So you start seeing these things that's not even real, right? And how to respond, and do certain activities, move them away from the trigger point, take them outside, listen to music, do something different, right? Modify the environment, check misinterpreted or lighting, even the lighting itself, right? You want to cover the mirror sometimes, right? Because if you're seeing things and then there's a mirror there and you got vision problems and hearing problems, it could be me in the mirror, but they're saying, oh, there's a crazy looking monster right there, right? So they can have fear, anxiety, and then the fact that they can't process that, they're going to be agitated and restless, right? So little thing like that, and then even just kind of walking in the hallway when things are like a black paint or something like that instead of white, they might see that literally as like a hole, and they're gonna fall into that hole, right? Because of the vision issue and their brain process is different, right? And they're trying to pick it up. You see many times the what's her name that's always at the nursing station. Huh? Yeah, and she's like, there's a white patch right there, right? I've been trying to get a hold of the maintenance, but she's like trying to grab it all the time, right? And she probably thinks it's donut or something, right? And she's like, where is that? I'm like, every single time I see her, she's trying to grab that. And at some point, she's probably gonna fall, and that's when I probably say, oh, I gotta get this fixed. But I gotta get a hold of maintenance to see if we can get that fixed. Um, so yeah, certain things like those we don't think it makes a difference, but it does, right? Um, Memory loss and confusion. In the earlier stages of Alzheimer's, memory loss and confusion may be mild, but in the later stages, memory becomes far more severe. Okay, and this is where you kind of provide reassurance to the resident. Just let them know that hey, everything's gonna be fine. If they tell you something, you have to agree with it, right? Because you're not going to be arguing with a resident that's confused, right? So just kind of reassure them, yeah, I thought it was this. If they were saying, hey, and they're referring to the daughter as as their sister, or maybe their son is their husband, you can just say, oh, I thought it was your son. It's. But if you scold them and say, no, that's your son, that's not your husband. That you never want to do that with somebody who has confusion, Alzheimer's, dementia, right? Just say, oh, I thought it was somebody, yeah. So reassuring them and making them feel comfortable is going to be really important for these residents, right? Um, and then also repetition. These residents will repeat things over and over and over again, right? A person with Alzheimer's may do or say things over and over again. Environment influences also can cause symptoms or make them worse. People with dementia who ask questions repeatedly, maybe trying to express a specific concern. So how do we deal with this? How do we deal with somebody who does repetitive stuff over and over again? Does anybody have any solutions to that? Try to find the root problem. Okay. Anyone else? And how do we do that, Zach?
I guess it would be case by case. If they're asking for, like, if they're asking constantly to go home,
Yeah.
they're asking, can I go home? Can I go home? It's like, what do you need at home? Can I get it for you? Something like that.
Yeah.
Trying to find what they actually want.
Right.
There may be
Redirect
something
them.
they're wanting. Maybe they're wanting food. Maybe they forgot their purse.
Yeah.
Yeah.
Yeah, go to the bathroom. Anyway, use the bathroom. That's correct. Yeah, yeah, yeah.
What their actual question is.
Right. They could literally, like, they could really mean something. Those things of going home may mean something different to them, right? So look for a reason behind the repetition. So, you're right, Zach. Look at that. Does the repetition occur around certain people or surroundings or at a certain time or day, right? And is the person trying to communicate something else, right? As is what Zach just said, right? Use memory aids. If the person asks the same question over and over again, offer reminders by using notes, clocks, calendars, or photographs if these items are still meaningful, right? Engage the person in activity, right? If you can't get them out of that repetitive type of thing, go do something else with them, right? Get somebody else to kind of help you out too, right? Change the subject, right? So, let's see what else is in here. Sundowning. What do you think the cause of sundowning? Right? It's later in the day. You know what I mean? It's they've had all day, kind of what's going on, right? And these patients might be, they're awake all night, right? And they're taking naps in the morning, and their time frame is all whacked out. So, but usually, typically, they're by that time around, their medications are kicking in from the morning. They're having interactions, and they're tired and frustrated already. So they're having these sundowning, right? They don't know if it's day or night, and so they get a lot of these behavioral issues in the afternoon. Okay. How do we respond to sundowning? Plan more active days. They say in here to, like, if they're not sleeping at night, try to avoid, um, you know, um, no naps or whatever, right? So they can fall asleep at the right time. That's difficult because they're tired and they're gonna fall asleep. They're gonna fall asleep, and now you're gonna wake them. Hey, wake up! Don't take a nap. But also they talk about too, like, don't have them watch TV late at night because that might keep them awake. So those are things. Give them an environment. If there's sleeping time, right? It's 8 o'clock. It's time to go to sleep. Give them a good environment that's comfortable, good temperature, not too much light. Turn the TV off. Not too much noise. Those type of things to promote sleep, right? And then in the morning, have activities so they don't take naps, right? So, but uh, just promote safety too. They're going to be wandering around, looking around, and um, so you want to promote safety. Okay. And then that's the last thing is what we're going to talk about here is really wandering, right? Residents that are, we don't see it here a lot because a lot of residents are not physically able to walk. But in the Katzen unit, a lot of them are able to walk and they're just kind of like wandering around, right? And so our job really as caregivers, as nurses, as CNAs, is to keep them safe and and to change and redirect them when they're starting to wander off, right? If a patient wants to go to direction, A, and you're trying to go to B, and you're not gonna force your way and say, hey, you know what, this is not safe. Let's go and drag you over here. Get somebody else to help you. Try to change the subject or bring them around in some other way. But being physical with the resident and raising your tone of voice to kind of scare him off to go the other way is not gonna work. Okay, so but basically our main goal is to keep them safe when they're wandering, right? Any questions or any suggestions, right? Anything? Let's go over this test real quick, guys. Did everybody get a test? Pass this around here. Okay, resident in first stage of Alzheimer's may seem absent-minded or forgetful. That's true, right? All right. In the first stage of Alzheimer's, the resident starts forgetting things that happened in the past. Yeah. So yeah, you don't forget the past, right? So in the second stage of Alzheimer's, residents may forget to bathe or how to adjust the water temperature. That's true. Okay. This one right here, person-centered care. We didn't really talk about this. You focus on meeting the residents where he or she is, not where you want her to be. We kind of just at the very end there, right? That's true. That's person-centered care. A sudden increase in dementia, anxiety, or delirium can be a sign of aggression. A sudden increase, right? With Alzheimer's is progression, right? Progression slowly over time, right? Anything that's sudden, guys, it's usually like an infection or a fall or a rip or whatever, right? Something that's acute is going to be related to like an infection, a sudden change, right? It's never going to be these progressive type of changes. Okay, forcing a resident to face reality can cause the resident to wander to become aggressive. True. Aggression or verbal outbursts can be caused by fear and frustration about losing control. True. When the residents wander, it is best to be firm and aggressive in letting them know this is dangerous behavior. False. When you approach the resident, always approach from the front. That's true. And then last one, you can improve the quality of lives of those with Alzheimer's disease with person-centered caregiving. That's true. All right, guys. Any questions or suggestions or anything? Right? Okay. Please just sign in, guys.
I'll take
Yeah.
something to do.
Thank you.
Keep them busy.
Yeah.
That's a
Yeah, napkin and repetitive